Ovarian cancer is the sixth most common cancer in the world affecting women. Approximately 1 in every 100 women will develop this disease, mostly women over the age of 45, although it can also occur in younger women. While there are screening tests for breast cancer and cervical cancer, there is as yet no early detection test for ovarian cancer, although research is underway to find one.
The problem with ovarian cancer is that the vast majority of women present with advanced disease, so you're already behind the 8 ball in trying to manage it.
Usually affects women who are postmenopausal, average age of about 52, although 1 in 5 will be premenopausal.
A lot of these women are actually surviving for 4 or 5 years now because the cancer itself does respond so well to chemotherapy. So we're very fortunate in the sense that we can get women into remission, even with very advanced disease.
It has enormous emotional impact as well as physical impact because it does have a bad reputation. So part of the problem of dealing with ovarian cancer is dealing with also the enormous emotional and psychological issues that occur along with this diagnosis.
It sneaks up upon you within 12 months. One lady I'm thinking of had a 15 centimetre ovarian cancer, having had normal scans 12 months before. It's a very silent and an insidious disease, and unfortunately it does spread without giving much in the way of symptoms until quite late in the piece.
There are 3 types of ovarian cancer, but by far the most common is epithelial, which is the focus of this program. The name refers to the cells on the outer surface of the ovary where the tumour grows. It may start in one or both ovaries and can also spread to other parts of the body, causing secondary cancers called metastases.
So the stages of ovarian cancer are based on the extent of spread of the tumour. And so if the tumour is confined completely to the ovary with no evidence of spread elsewhere, then it is regarded as a stage 1 tumour, despite the size that it might be. So you can have stage 1 tumours that are 20 centimetres, 30 centimetres, but as long as the tumour is confined to the ovary, it's stage 1 and it has a pretty good prognosis. Stage 2 tumours are tumours in which the tumour has spread outside the ovary to the pelvic organs, so that might be the fallopian tubes or the surface of the uterus or various other sites in the pelvis. And again, the size of the tumour or the size of the amount of spread really doesn't matter. It's just the fact that it has spread to the pelvis. Stage 3 is the stage at which most patients are diagnosed. 70% of ovarian cancer patients will be diagnosed with stage 3 disease. And that's the stage at which the disease has spread outside the pelvis into the abdomen. And that means that any place in the abdomen can be involved. It's the peritoneal surfaces, so it's not meaning the inside of the liver or the inside of the stomach or the inside of the spleen or the bowel, but on the surface of the liver, diaphragm, stomach, or any of the peritoneal surfaces. And that would make it stage 3. And stage 4 is distant spread outside the abdomen.
I had a tumour on my large bowel. I had tumour on my omentum, my diaphragm. I had a plum-sized tumour on my left-hand side. I had tumours scattered, like scatter nodules, all over my peritoneum. And by the time I actually got a diagnosis, my C-section scar was a row of tumour ulcerating through the skin.
Being in her 30s, Julie wasn't considered to be at high risk, so the cancer came as even more of a shock.
Well, when a woman is diagnosed with ovarian cancer, one of her concerns might be, now that I've been diagnosed with ovarian cancer, does this change the risk to my daughters or my sisters? And the answer to that question is generally no, because most ovarian cancer does not run in the family. And having one person with ovarian cancer does not tend to change the risk for other women in the family. The only exception to that is some rare families where there is a very strong family history, and that family history can involve breast and ovarian cancer in different generations of the family, or sometimes a different pattern with bowel, cancer of the uterus and ovarian cancer, and it's those rare families where there is a genetic predisposition, and your doctor will take that family history and possibly refer you to a family cancer service if that's the case.
I did take the pill. I did have babies. It's like being run over by a bus. It's just one of those things. Yeah, it's rough, but my kids are big. I mean, they're 19 and they're 21. And yes, I want to be around as long as I can be around. And the other thing is that long-term survival, although it's low, it's not zero. So I'm not actually giving up yet.